From America back home and onto Health Watch, the government says it is ready to hold talks with the Kenya Union of Clinical Officers to ensure uninterrupted service delivery.
This comes as the Council of Governors pledged to address some of the grievances of the clinicians, among them the accreditation, of registered facilities to the Social Health Authority.
Meanwhile, nurses in Lamu County staged a protest calling on the county government to address their issues, among them delayed salaries.
Here's that report.
On Monday midnight, clinical officers across the country downed their tools, escalating their push for better working conditions. Addressing the media in Nairobi, the Kenya Union of Clinical Officers officials called on the Ministry of Health to empanel registered facilities to the Social Health Authority and allow pre-authorization services of practitioners. The union also demanded the negotiation of their 2017 collective bargaining agreement.
We cannot be able to pre-authorize. We cannot be able to see patients through the Social Health Authority. And so we are going to remain on strike until that day that we will be able to see our clinical officers pre-authorized and our facilities empaneled. And we also see goodwill in the implementation of the return to work agreement.
Why should we negotiate a CBA for close to 7 years? And yet a CBA has a life cycle of just 4 years. So meaning we are completing 2 cycles without a CBA.
In a meeting which brought together the Ministry of Health, SHA authorities and digital health agencies, the Council of Governors ordered the pre-authorization of practitioners and empanelment of facilities registered by the Clinicians Council to the Social Health Authority.
Ministry of Health and the Social Health Authority will implement the resolutions of the consultative meeting held on the 14th of January as here under that. 1, Social Health Authority shall empanel and contract facilities and practitioners pursuant to Section 33(2) as read with Section 31(3) of the Social Health Insurance Act and regulations.
Because if a clinical officer is using a license of a doctor and then it's not the doctors who are treating, then it means that that doctor is the one who is responsible for anything that will happen. And that is why it is important to give them the rights directly, because they are the ones who are offering those specialized services in the level 2s, the level 3s, and sometimes level 4, because there is no level of facility in Kenya that you cannot find a clinical officer.
However, the government says it is ready for constructive dialogue with the union to ensure uninterrupted service delivery.
We are very committed to honoring the CBA with the clinical officers. And I don't think jeopardizing the health of fellow Kenyans is good, because we have, trod this path before. We have been there.
This comes as nurses in Lamu County stage a protest lamenting over delayed salaries, threats from county leaders, discrimination in promotions and career progression.
Watu wanalipwa tarehe 22, tarehe 30, tarehe 1, 2. Sisi tunakaa mpaka tarehe 25 mwezi mwingine unapoingia. Hii haikubaliki.
Hatungependa kuwa kwa mgomo, lakini waangalie mambo yetu kiusawa. Waangalie mambo kisheria.
Speaking outside the County Public Service Board offices, the nurses complained of being ignored by the county government and called upon Lamu Governor Issa Timami to intervene and address their issues. Kasichana Masha, Prime Edition.